I'm excited to share with you the Foundation Online course module on laminitis. We know laminitis affects so many of our horses today, and it's an epidemic, right? And we're all very focused on helping our horses either manage it if it happens, heaven forbid, or certainly prevent it if we can do that. Because how in the world do we go from having this lovely little hunter jumper pony who's eating up the ring and end up here where this pony is now just miserable and can't walk and fell apart and crashed, even though he was in work consistently? Yes, that's the same pony. And then get back to some semblance of soundness, quality of life, and whether it's a companion level of activity or whether they can go back to their previous jobs, right? And then my biggest question is always, how do we prevent it from happening in the first place, right? So to me, the first place we need to start is, what is laminitis, right? Because if we can understand what it's kind of about, then I feel we can make better quantitative and qualitative decisions when it comes to managing a situation or preventing a situation. So the lamini are very complex and very difficult to understand. And so laminitis is technically defined as inflammation of the lamini. The lamini are that connection of the hoof wall to the bone. They look like pleats on a lampshade. So here I put in a lampshade for us so you can see why they look so similar, right? Here are the insensitive lamini that have no blood and nerves, and the sensitive lamini with blood and nerves. And they sort of interlock together like Velcro, sort of opposing pleats that kind of fit together quite tightly. And they run from the coronary band to the ground following the bone, okay? And so if we look at our foot critically and what really keeps everything held together, what we affect as hoof care providers is the horny structures on the outside of the foot has no blood and nerves. That's what we trim, and that's what the horse stands on. And all the soft tissue structures are inside the foot, has blood and nerves, is sensitive, and grows the outside. So the hoof capsule, therefore, I think of like our shoe, and we want that shoe to fit tightly around the internal structures, which is like our foot, right? We don't want a big floppy shoe. We don't want leverage on the shoe or on our foot. And so these two things fitting together tightly is critical. And of course, the lamini are a big part of that. So these are two images from Dr. Pollitt and Dr. Van Epps, and when they were doing their cryotherapy studies. And on the left here, you have a picture of healthy lamini. Okay, so this is the insensitive lamini on the white side, basically the light side here with the tubules. These are tubules, these round things. And then on this side, this is the sensitive lamini where it's darker red. And you can see here how you've got primary lamini, and then off the primary lamini interconnecting with primary lamini on the corium side, you have secondary lamini that come off like little fingers, and they all interlock together as well. And what's super scary about laminitis is that after you have a bout of acute laminitis, this is the appearance of laminitis you get here on the right. And you can see how these lamini are elongated, right? They're stretched out, they're thinned, right? They're a lot of the little secondary hair-like protrusions there, they're like pleats, but they're, they come out and they're smaller. They're gone. And all this empty space here in the middle would be filled with serum. Basically, damaged tissue, dead tissue, necrotic tissue. And we see that on the radiographs, like that gas line that's in the dorsal wall. And that's what's so scary, is to really picture that this Velcro is not only not connected, but also way damaged, right? So when the lamini fail, it is catastrophic to the foot. And unfortunately, it's very hard for us to have a crystal ball and know exactly how much surface area of detachment of the lamini are connected versus not in any acute bout of laminitis. So to me, every case of laminitis should be treated as an emergency, because we don't know where this slippery slope ends and we don't know how much damage there's been. So why does laminitis happen, right? Like, why would horses get something like laminitis? So traditionally, we think of the causes of laminitis as generically being some kind of acute illness, like with a high fever or like a grain overload scenario where the pony gets into the feed bin and gorges on grain. We have metabolic dysregulation, which is any of the insulin resistant, equine metabolic syndrome, Cushing syndrome kind of classifications. We have some type of mechanical road founder concussive cause of laminitis. And then we also have compensatory limb laminitis, which is the horse broke its left leg and now the right leg is the main weight bearing leg and it falls apart. But one thing that stops me in looking at these causes is, why doesn't every horse that develops laminitis, let me say that the other way. Why don't all horses who have one of these four problems develop laminitis? So, for example, they've done studies where they'll tie up one horse's leg for an extended period of time and they don't founder on the supporting limb. Or every horse that jumps, why don't they have all this concussion on various surfaces and various disciplines? Why don't they all develop laminitis? Or why don't all fat horses develop laminitis? Okay. So really there's got to be something more going on that affects some of these horses. Now, for a moment, let's just talk about laminitis and inflammation, because we all think about laminitis as being an inflammatory process. However, even though the definition of laminitis is inflammation of the laminae, we now understand that the inflammation that happens, which we experience with pain, heat in the foot, and digital pulses in the distal limb, is actually a byproduct of the laminar failure. Okay, so the laminar failure happens before there is inflammation in the feet and the laminae. Something underlying is causing a systemic reaction, which then triggers the detachment of the laminae at a cellular level. Okay, this all happens without us necessarily knowing that there's a problem. And so then when that systemic cascade happens, right, then the laminae start detaching, and that detachment causes the inflammatory process. Okay, so laminitis, therefore, at its very basic foundation, at its roots, is caused by some degree of toxemia. Okay, toxemia is defined as a clinical state caused by a widespread activation of defense mechanisms to the presence of toxins produced by bacteria or injury to tissue. Okay, so when you have a toxic horse, when you have a horse that has an underlying problem or goes through a traumatic event, we all have stress and wear and tear on our own bodies constantly. How much stress and toxic situation you might have in your body or in the horse's body is going to influence your ability to respond to new traumatic event. And eventually your system cannot keep up, right? So circulating endotoxin, right, which is the byproduct of a toxic situation, right? It can induce this systemic inflammatory response, which is where we get the SIRS idea, systemic inflammatory response syndrome, or what we might call a sepsis cascade, right? Where the horse just gets toxic. So in lay terms, we talk about these things casually, but this is really a big part of the dynamic that happens with our horses with laminitis. So that's why laminitis, for all intents and purposes, is from a combination of problems, not just one cause. And that's what would mean the difference between some horses with, an injury to one leg getting laminitis and one not, is kind of the underlying level of inflammation and toxicity that horse is already trying to manage. Okay, it's why some fat horses founder and some don't. Okay, it's why attacking laminitis and managing it, preventing it, what have you, is a whole horse proactive sort of endeavor. Okay. So some of the common problems that you might see, and we know this, we know that our typical, teenage or older metabolic type horses have a whole slew of common problems that they might deal with. Like if you have a horse that's in a situation of just general stress overall, my best friend died, or I'm at a new barn, or I'm not managing my lesson program well, or what have you. Okay. They might have compensatory posture, which, understanding the model of hoof care that I prescribe to, that we look at posture in terms of how is the horse managing the input they're receiving to their nervous system from their mouth, dentistry, TMJ, all of their bones in alignment, how they're interacting with gravity, and the nerves from their feet, and of course over their entire body. And if they're not standing up in a neutral place, then they have a lot of added stress on their system. Certainly, we know the teeth are a problem. If you see EOTRH, equine endoclastic tooth resorption and hypercementosis in a horse, that is a huge indicator of systemic inflammation. Uveitis, another one, sensitivity to bugs, certainly soft tissue injury, we know goes hand in hand with uncontrolled metabolic problems. If a horse has a vaccine reaction, why don't all horses have vaccine reactions, or no horses have vaccine reactions? Because some are more sensitive to whatever it is in that vaccination or that immunization that sets them over the edge, like steroids, right? Some horses can have steroids, and there's huge benefit to steroids when you have certain conditions. But then why is it some of them get a dose of steroids to deal with a problem and they end up falling apart and getting active laminitis? So these are the kinds of things we can look at to understand a little better about how much risk is a horse at potentially, but also how is what kinds of things do we need to address in order to help a horse get over that hurdle into some semblance of recovery, right? To a place where they can heal. So how is laminitis different than founder? Why do we use these two words? Okay. The first thing I want to say is, even though we say founder casually amongst each other, I prefer to eliminate the word founder because it's really not clear enough. Laminitis is defined as inflammation of the laminae. We know that. Founder is actually a lay term derived from nautical terminology, to dive, as the bone dives down like a ship in the water. Here, this is an illustration, animation of the Titanic from National Geographic. And you can see here how that the Titanic unfortunately rotated a fair bit. And even though the coffin bone doesn't break away, it does rotate and dive down. And so founder, therefore, refers to the rotation and sinking of P3 within the hoof capsule. But it's not specific enough. And we use these two words interchangeably, and it can be very confusing. Well, my horse foundered. Okay. That doesn't tell me anything about the current clinical situation of the horse or what I might expect walking into a barn. So I instead like to use the word laminitis specifically when I'm talking about a specific situation with a specific horse. We talk about developmental laminitis, which is that first bout of laminitis a horse might have before the external signs. So remember, we just talked about laminitis as being defined as inflammation of the laminae, and yet the inflammation is the byproduct of the laminae detaching, separating, letting go of their attachment based on some kind of level of systemic problem. Okay. So that's why developmental laminitis means you are actively detaching the laminae at the basement membrane because of whatever systemically is going on, but you're not yet at a point of inflammation that you see the external signs, which is what gives you the pain or any kind of foot changes or heat or digital pulses. Okay, so developmental laminitis is scary because it's going on and we don't even know it. And so developmental laminitis can happen to any horse at any time. So we have no associated foot type, right? So in terms of the foundation hoof types, any foot type can get developmental laminitis. Okay. Acute laminitis then is that first bout of laminitis, which is now active, inflammatory. The horse is painful. They've got heat and pulses. And again, this can happen to any foot type. Okay. So there's no associated foot type with this. Arguably, maybe the horse would have an ideal hoof type for developmental and acute, but not always, right? But that's a whole nother conversation that gets into when we have hoof distortions, how much laminitis is involved in that, in the distortion. So that's a slightly different conversation. Where when we get to chronic laminitis, so to me, chronic laminitis is when we have rotation or sinking of any kind, okay? And that's going to be our foundation hoof type 5 feet. And they're going to distort a certain way. And you've got your subacute horses, right? So chronic laminitis means the horse has a history of laminitis. They've had some rotation, sinking, displacement of P3, but now they've got an acute flare-up. And those are a lot of the horses that we see in the field as hoof care providers because they're not critical enough to go to the clinic and be hospitalized like our all-out acute laminitis crashing horses that need acute intervention care. We mainly see the chronic laminitis cases that are subacute or stable, meaning their feet are ugly, they've had rotation or sinking, but they have no active acute laminitis, okay? So chronic laminitis is where I would go to for founder. Instead, I would say chronic laminitis subacute or chronic laminitis stable. And then we have this last classification of laminitis that's a little newer, subclinical. And that type of laminitis is when you have this chronic kind of slow cooking laminitis, yet you don't necessarily see external change in terms of pain or inflammation or digital pulses. And yet you have signs in the foot that there's been laminar change. So these are our distal descent horses, horses with retracted soles. We often think have subclinical laminitis because the bone has sunk a little in its suspension from the laminae into the sole and caused a thinning of the sole corium and made that more problematic. That's a theory. We don't know, but that's a theory. And then anytime you have white line disease or wall separation, that's a such section of laminitis, okay? Now, that's defined by a lot of our leading vets that work with laminitis and research laminitis and teach about laminitis, okay? That doesn't come from me. None of this comes from me. This all comes from our amazing veterinarians who have taught me over the years about laminitis, how to approach it, how to conceptualize it, and what to do with it, okay? So a lot of our veterinarians will say, when you have subclinical laminitis, right? You have this subclinical laminitis down here that are chronic laminitis subacute horses probably have this subclinical laminitis much, much longer than anybody's really aware of. And so they might be chronic stable, they might look normal, but they typically have this slow brewing subclinical laminitis going on for a very long time before they necessarily roll over into chronic laminitis subacute. Okay, and you may or may not see changes, but you will eventually see pain, and then they're rolling over into laminitis, and then you might say, "Oh, my horse's foot sore after a trim," or "Oh, my horse's feet, they're not tolerating walking on rough terrain as well as they used to," or their foot just doesn't look as robust. These are signs that you might have some subclinical inflammation or subclinical laminitis going on and would be worth talking to your farrier and your vet about, okay? So when we look at these in a little more detail, you've got developmental laminitis first, right? Before the onset of pain, heat, digital pulses, the laminitis has already started. You may be able to nip the laminitis there if you know that you had something that might create some laminitis. Like you have a pony that gets into the grain bin and you're thinking, "Oh my gosh, we could have developmental laminitis right now." You're going to take proactive measures to help try to prevent that from rolling over into active laminitis. The best course of action at this point, if you suspect that laminitis might be a risk factor, is to confine your horse in deep bedding, call the vet, and get them out there to see your horse as quickly as possible. Some veterinarians would recommend cryotherapy at this point to calm down the disconnection of the laminae, which we know from Dr. Pollitt and Dr. Van Epps' work on cryotherapy. A lot of times we miss this phase altogether. And this is just a very scary part if you know that your horse has been exposed. A lot of times the only way we know that the horse is actually laminitic is when they're acute, is when they're showing us pain. And so, this is like, now you have an all-out emergency on your hands. They might have a rock back stance. They might have difficulty turning, shuffling through their turns, difficulty backing up. put them in a deeply bedded stall. You see here now we have the horse on some shavings, the feet are on fire, the bomb has exploded. We're going to call the vet, of course. The vet is going to dictate management. The farrier has less of a role in this point. We might be putting boots on the horse, but really this is a medical intervention. And certainly most veterinarians at this point would recommend cryotherapy, but call the veterinarian immediately. If I'm at a barn and I suspect that this horse is having acute laminitis, I would not diagnose that to the owner, but I would just say I would be concerned about something going on here. I might say, we need to check in with your vet. I'm concerned that you might have some laminitis and we need their intervention. Okay, so I would never say, oh my gosh, your horse is laminitic. We need to call the vet right away, because that's me diagnosing that horse with something. So I'm careful with the way I present that, but I do light a fire under my owners to say, hey, we need the vet here right now to figure out what's going on. Now, when you get to the chronic subacute laminitis, that's our hoof type 5 horses, right? They're going to already know the diagnosis has been done. We know that they have laminitis. We might even know why they have laminitis, hopefully. The ticking time bomb here has gone off. The horse's feet are on fire. The horse is going to be deeply bedded on soft footing, probably with boots on. The farrier has a little more of an active role here, because usually these horses are ready for some kind of foot management as well as the veterinary intervention. And you can see here I have the word Beamer in here. I put that in here because we need to do whatever we can for these horses to start minimizing, anything outlying that might be affecting this horse and helping the horse heal, and managing and improving microcirculation or other modalities that help with those kinds of supportive systemic care are things that are really beneficial. Okay. So, at this point, the horse is definitely painful with heat and digital pulses, often exhibits that rock back stance or has trouble turning, rather, difficulty backing up. If the horse gets more stable, then we might be considering more hoof care interventions. But you want to make sure that you're not pushing this horse along so fast that you tip it over into more difficulty. And we'll talk a little bit about that more in a moment. The chronic stable horse, the horse is stable. The feet have been dealt with. There's no pain, heat, digital pulses. You're on a maintenance routine. You're probably on a dry lot. The horse now has some buddies to be out with. Of course, the vet's involved. You might be restricting diet with these type, metabolic type horses. But maybe you're getting back to some work. I'd like to think, hey, when are we hitting the trail? When are we getting back to some work? Like, it's a positive thing, right? Because the horse needs an appropriate amount of exercise to stay healthy, especially if it's a metabolically derived laminitis. Healing through movement, though, we know that that's important. So now once this horse is stable, you want to be able to maintain that horse long-term with management and preventative care, right? And you're always going to worry a little bit. But if you keep an eye on them and you've got your hoof care, your environment, all the factors dialed in, then this horse is going to do well. Now, this last part we talked about a little bit, subclinical laminitis, are hoof type 6s. Again, they often go on long-term and they're undetected. You've got huge ticking time bombs here, right? Huge ticking time bombs, but you may not even recognize that there's a problem, which is why we need to start being a little bit more aware of some of the things that horses do that we say, oh, he's foot sore today, or, oh, this is going on. And in reality, these are signs that the foot is struggling and we need to pay attention to that. Like being sore going over rocks when they were sound before, like always being sore after a trim when you have a really qualified hoof care provider that knows what they're doing. And you're like, why is this barefoot horse getting sore when I should be doing a maintenance trim? This shouldn't be a problem for this horse. We need more information. And if you have chronic white line disease or separations in the wall, again, those are indicators for a lot of veterinarians that you have subclinical laminitis going on, because the white line isn't strong. It's not able to do its job of preventing the infiltration of bacteria and debris. So if it's not doing that, it's because there's a problem. So maybe bring that up to your veterinarian, okay? I don't mean to sound pessimistic here, but most horses probably have some degree of low-grade laminitis in their lives, right? I mean, think about how many things assault the horse and their feet. So this is something we just need to be mindful of and think of in the short and long-term picture. Okay, what about this whole laminar wedge thing, right? I mean, this is a big deal. We talk about the laminar wedge. Some people leave it, some people take it. It does cause certain problems. It is protective on some levels. So let's look at this in more detail. Okay. So if the job of the white line is to seal the sole to the wall and prevent the infiltration of bacteria and debris, if you have a healthy white line here on the left, you've got a straight dorsal wall following the bone, tight corium, whatever amount of sole depth you might have, and a ideal hoof pastern axis with palmar P3 angle, right? Tight white line. Okay. If you have a stretched white line, now we use that word a lot versus laminar wedge. Okay. A stretched white line, to me, you're going to start seeing some signs that you've had some laminitis, right? Maybe a dish to the dorsal wall. Maybe the corium is going to start getting a little thicker because of that stretching of the laminae. And the white line is going to be wide, but the laminar wedge or the white line is not going to go higher in the foot than its growth point, which is the terminal papillae of the distal border of P3. Okay. So in this case, I would call this a stretched white line. And what that means then is that if you come in and you take this dish down in your trim and you don't expose stretched white line on the dorsal wall, I would call that a stretched white line instead of a laminar wedge. Okay. It's about the degree of severity at that point. Where the laminar wedge is truly a functional scar, where you've had the Velcro like attachment, pleats on a lampshade connection of the laminae fail. And so therefore, your foot fills in that space with disorganized keratin, right? It's like it's forming a scar. It's saying, oh my gosh, there's all this damage. We need to stabilize this as fast as possible. And so we're going to lay down this disorganized material that's going to form the laminar wedge. And it's a disorganization of horn material, tubules, and sort of what would make up the white line, except all those laminae are now disorganized. And so it doesn't produce it in an organized way, but it can be very functional and very strong. Okay. So that laminar wedge is keratin that fills the space created by the rotation of P3 away from the wall here. Okay. That's as simple as it gets. So when we look at this in practical application, you've got here a healthy foot on the left. Your outer wall has the dark pigmentation, more tubules. Your inner wall is the higher moisture content, white wall that has less tubules. Then your white line grows from that terminal papillae, and it's a blending of that horn of the inner wall and then the laminae, right? The insensitive laminae, and the sole, right? The sole. And then on a chronic laminitis foot, instead, you're going to see the laminae here these striations are stretched longer. And that's why we call it stretched laminae or laminar wedge, because it's this insensitive laminar material that we see, okay, exposed on the bottom. And that's why it has all these striations, because it's those pleats that are stretched out. So the other thing that I differentiate in laminitis is two different kinds of chronic laminitis. Type 1 is where you have that rotation and you have new growth coming in parallel to the bone, so you can kind of grow back in a tighter connection. The type 2 chronic laminitis horses are more severe. They've had more damage chronically over time, and now that laminar wedge goes all the way to the coronary band. And what that means is that the new growth is not parallel to P3, and it never will be. So these are a much more difficult management issue, the type 2s, and they tend to cause more problems over time. You can stabilize them, but they're never as good as you want them to be, because this dorsal wall angle will appear way too shallow. And yet, if you make it steeper to a point, you're going to hit the corium. Okay. So, this corium can often migrate a lot more than this as well, and it just creates a huge problem. So, these you need radiographs on, and they're the kind of situation where it's management, and it's going to be the best it can be depending on the situation. Doesn't mean the horses can't be comfortable. It's just more difficult. So our role as the hoof care provider is very specific. Okay. We need to understand the pathology, and then we need to formulate a plan on what to do at the right time. And so while it's very simple, it's also incredibly complex because laminitic horses, their feet can present in so many different ways. Okay. So if you think about the different types of laminitis, developmental, acute, chronic, and subclinical, we are really, as hoof care providers, we are really dealing with the last two, the chronic and the subclinical. The all-out acute horses, they tend to be veterinary management, and maybe boots will be applied, and you're really kind of taking a secondary supportive role to the veterinarian in supporting hoof protection and pain management, but may not be making big changes yet, depending on the vet. So we're really going to be dealing with our type 5 high palmar P3 angle chronic laminitis feet. Those are the palmar angles greater than 8 degrees with a collapsed toe arch. And we're going to be dealing with our distal descent horses where they lack vertical depth. And that's kind of your subclinical types typically. Okay. So, if you look at, like, say, the club foot, remember the club feet do not have capsular rotation. They only have phalangeal rotation. And technically, to me, a true club would have no signs of laminitis. Otherwise, you have a chronic laminitis foot that happened to be a club when it started. Okay, now that's splitting hairs a little bit, but it's easier for me to think about it that way in terms of management and treating those club feet that have, big dishes to the dorsal wall and wall separations and toe cracks and flat soles in front of the frog apex. Those horses have had laminar failure. So they are, to me, chronic laminitis horses. And I need to remember that in their management. So that's why I classify that a little differently. These type 6 horses, they can be acute, right? They can show pain and inflammation or not. So they're a little bit insidious that way. Okay. So we're still going to go for our foundation hoof guidelines, right? We're still thinking about, as a hoof care provider, again, thinking about the external part of the foot as the horny structures and the vascular sensitive structures on the inside, like our foot in a well-fitting shoe. We want these things to all fit together tightly and have strong connection. So we're going to use the foundation hoof guidelines for a realignment trim for chronic laminitis. That's where this comes in. It's still our starting point for what we're doing. But we need a few more guidelines in laminitis, okay? So I've got 7 more for us, and I'm going to go through them quickly here, and then I'll expand on them in future content, okay? So the first thing you need is you need a team. Of anything we manage with the horse in laminitis, you need a team, okay? Every person helping the horse needs to be on the same page. You absolutely need radiographs. In these cases, it's going to give you the best information to create your plan, but also staying safe. And because laminitic horses can present so many different ways inside their foot compared to outside, there are things you can see, but it's such a slippery slope when it comes to what's changing when. You really need radiographs, period. Of course, we're going to go for realignment, okay? So we're going to use those foundation hoof guidelines to aim for that capsular and phalangeal realignment. But this is going to come to the forefront in our hoof care work for our chronic horses. We really don't want there to be any deviations, flares, misalignments of the capsule and the internal structures, right? Acute versus chronic, right? They're different. Acute horses are going to be more like the unstable horses, and they're going to be more in the veterinary realm, where the chronic laminitis, which are more stable, even though they can be acute, it's subacute, right? Those are more in the hoof care provider's wheelhouse. We're going to treat these 2 types of horses differently, okay? Number 5 is hoof protection. Always be prepared to protect the foot with boots, diapers, shoes, etc. You need to have an immediate access to protection if you're working on chronically laminitic or subacute or distal descent horses. They need protection. You want to consider leverage, right? Number 6 is important because when that horse has a long foot and it's like leveraging on a hangnail, okay? It's very painful and causes continual damage to the laminae ongoing, okay? So thinking about leverage, we think about heel height, we think about toe length, footprint placement. We want to relieve the white line or the laminar wedge from the ground, and be careful when we're lowering our heels, because if we lower them too fast, it can increase leverage on the laminae. We'll talk more about that in a minute. And then number 7, kill the bugs. It's just a great way to think about the fact that secondary infection is one of the biggest risks for chronic laminitic horses, because their white line is not tight and their circulation's not great. So they're at risk of bringing in secondary infection. So keeping the feet clean and dry and using antimicrobials is really important. And so when I see a chronically laminitic horse that's out in a mud bog, I think this is impossible. This horse is going to die just from a secondary infection, let alone whatever else is going on. So I'm pretty much a stickler about guarding against the potential for secondary infection. And then the last thing here, this note on the bottom, which seems like a subnote, but is actually really important. When you are looking at potential for laminitis or a laminitic horse, know when you're in over your head. Reach out to more experienced professionals when needed, whether that's a veterinarian you have a relationship with, whether that's another hoof care provider that's a mentor, whether it's honestly reaching out on social media or the internet. There's so much information now. And just be discerning about your decisions, right? Be a critical thinker when you're looking for what you can do to intervene. And we're going to have more content in this course to help you with some of these things as well. So, more is coming. Don't worry, more is coming. But we need to support each other too, right? Okay. So if you're looking at the overarching guidelines for laminitis, we're going to go with the foundation hoof guidelines: 50-50, 5 to 8 degree palmar P3 angle, straight hoof pastern axis, appropriate vertical depth, and balancing medial lateral in 3 dimensions. But we're also going to add in guidelines specific for laminitis: a team approach, using radiographs, aiming for realignment when appropriate, treating acute versus chronic horses differently, always having options for hoof protection for these horses, considering leverage and protecting that laminae when we're doing any kind of hoof care plan or booting or shoeing or whatever, and kill the bugs, guard against secondary infection. Okay? So when you look at the team, right? Veterinarian is going to provide the diagnosis. They're going to provide management of any underlying medical condition and pain control. Okay? The barn owner, manager, the horse owner, the trainer, other people involved are going to provide support for implementing the plan, right? Managing the daily routine, managing the environment, feeding the horse, all those kinds of things. So the owner is really in charge, but sometimes they're not the most knowledgeable person. This is why the team has to be really cohesive. Then the hoof care provider, right, manages the hoof with trimming, boots, or shoeing, and then supporting the veterinarian in their efforts to help stabilize the horse, minimize discomfort, things like that. And then we, of course, have our supportive practitioners or our integrative practitioners, like the dentists, body workers, chiropractors, any kind of supportive integrative care that can be provided to this animal. This is all critical. But if any one of these team members is on a different page, the owner is going to be really conflicted on who to listen to, and you may end up undermining each other. Okay, so that's super important, that number 1 guideline. Number 2 is radiographs, right? You've heard me say this several times in this presentation, that one of the biggest challenes with rehabilitating these horses is how diverse they are in their hoof capsules. So frequent radiographs is a critical tool for helping these horses as proactively as we can without overdoing it or being too conservative, because in my opinion, both would be detrimental. And these horses are going to look different if they're chronic, subacute, or stable. That's these kind of horses. Or if they're acute, unstable, these guys are scary. Okay, these guys can trip over themselves and fall over into an acute laminar failure, hoof capsule failure very quickly. And so, I really rely on the veterinarians to help me with these until they get to a better place where we can start making some changes. We've already talked about in the radiograph module earlier in the course that we look at 2 main views for hoof balance, lateral and dorsal palmar, right? We're also then in laminitis potentially going to look at this P3 solar margin or 60 degree DV dorsal ventral for P3. Excuse me. Not to diagnose anything, because that's not what we do, but we want to look at spatial relationships for any kind of gas pocketing, abscessing, looking at where the bone has remodeled to in the hoof capsule. It can be helpful to have this view if you're working on laminitic horses. I've circled here some of these gas pockets that you might see. Some of these vertical lines are actually air in the stretched laminae of the laminar wedge or fluid. Over here, this kind of speckly area is probably some debris in the white line there in that heel. That was just radiopaque. And so really, we're going to look at realignment in terms of what do we have now versus what do we need. So we've got phalangeal rotation here, right? Broken forward hoof pastern axis. We might look at the dropping distance, again, not as a diagnostic for us, but as a measurement of, I have a very tall looking hoof capsule here. How much room do I really have? That's the coronary band extensor process distance. We might look at the amount of dorsal wall deviation, and that's part of our capsular rotation. And it can be measured as the HL zone at the top of the coffin bone, hoof lamellar zone, versus the HL zone at the bottom, the distal part of the hoof lamellar zone at the bone, and compare those. And if one at the bottom's wider than the one at the top or longer than one at the top, you've got rotation. Or you might measure degrees of deviation, right? Now, this is not a prognostic indicator for me because I can take that down in my trim and it's gone, but doesn't mean the hoof capsule's any better or stronger connection, okay? You can look at the shape of your corium, just again as a reference area for what's safe versus what isn't. Your sole depth you can look at, to measure vertical depth, looking at the edge of the corium to the edge of the visible sole, not the bone to the ground. You're going to look at the palmar P3 angle, which again is a measurement of capsular and phalangeal rotation. Okay, and again, we want that to be between 5 and 8 degrees with a straight hoof pastern axis. Okay, and our goal is to realign this hoof capsule with those internal structures. And this is part of the foundation guidelines, phalangeal and capsular alignment. Well, the phalange is P1, P2, P3, right? That's our phalange, like our phalange, our finger, right? P1, P2, P3. And so the radiograph showing us what we have tells us what we could remove to improve things and what we need to keep, right? We want to preserve sole depth. We want to lower these heels a little bit. We want to back up the toe because now there's leverage on that laminae from that longer toe. Okay, so what do we have and what is in the way and we might need to remove? Okay. So when we look at realignment then, we do this when the horse is pretty comfortable, okay? We don't do this when the horse is super acute. If they're in boots and they're comfortable and maybe they have some heat and pulses, but their disposition is bright, they're stable in a way, they're not getting worse or more acute, you might be at a place to consider realignment. And so, you've got this new angle of growth that's coming in parallel to P3, okay? You have the heel that's too high. So my realignment trim is going to be very simple. I'm going to take this hoof capsule and I'm going to shape it back around the internal structures like wearing an appropriately fitting shoe. So in practical application though, that's a little more challenging, although here's where the radiographs become helpful, but you've got to be able to match the radiograph to the foot in front of you, okay? And this takes practice and you're going to be conservative at first and then you're going to get more bold, and that's where having progressive radiographs can really help you, looking at what do you have when you start, what do you take away, and what do you have? And I do this all the time to help me be accurate, and it's trained my eye and advanced my skill set, having those progressive radiographs. So you might take the dish out of the dorsal wall, making the growth line or making the line you create parallel to the new growth at the coronary band. You might back the toe up using the existing toe callus, ideally, without thinning the sole. And then you might lower the heels and blend that plane forward towards the toe so that you don't thin the sole under the bone. If you look at how that is going to happen and how I visualize this, and some of you may have seen some of my videos where I draw on laminitic feet and I draw with a Sharpie on the outside where the bone is and where I'm going to trim to. And inevitably, that's where it ends up, which makes me laugh, right? It's usually, oh, look, I'm just at my lines, right? So when you have phalangeal and capsular rotation, the green, of course, is the capsule, you are going to think about, again, bringing that new growth angle down to reduce the dish in the dorsal wall, lowering the heels and blending the plane forward, and then backing up the toe. Okay. And so this, I drew the lines on this idea of a hoof capsule. And then here I've reoriented the foot to those new lines, showing you what I would have removed. Okay. This is the foot that I would have removed that was in the way of this realignment. And then here's the capsule realigned. And this horse has decent sole depth, so that would have been appropriate in this case. So here's an example of a horse I did this with. This is a realignment trim where I looked at the radiograph and I said, okay, here's my growth below the coronary band. I'm going to take that dish out of the dorsal wall. I've got decent sole depth, so I can lower my heels and recreate my 8 degree palmar P3 angle, which will straighten up my hoof pastern axis, which is only slightly broken forward, but is broken forward. Blend that plane forward, preserving sole depth under P3. And then I'm going to shorten the toe by beveling and using my sole callus here as a guide. Okay. And so here is that foot before my trim and then after my trim. And this was a very painful horse, but his hoof capsule was very stable. And with my knowledge, skills, and expertise, I made a judgment that I could help this horse by realigning the capsule and then putting him in a boot for protection and comfort and cushion and support. And he did very well. And I can do this kind of thing in one trim with my experience. And maybe you can't, but that's okay. All right. The key is to learn and be knowledgeable with radiographs and having tools to support the horse and the support of the owner and the support of the veterinarian. Okay. So interestingly, what I did here is I took the after trim radiograph and I tilted it to fit where the lines were at on my drawing on the pre-trim radiograph. And look how close I was. I could have backed up the toe maybe a little bit more in theory, but for that day, that's as much as I wanted to do. You can see here a shadow of the gas line. So that's the detached laminae there. And it was a significant trim for him. And then lowering that heel, it turned out pretty darn close in actual reality. So I'm pretty happy with that. Now, what happens if you don't have a thick sole though? If you've got a thin sole and now you don't have enough room under P3 to really bring that plane forward. Okay. So again, here's the same phalangeal and capsular rotation, except now we've got a more stretched hoof capsule and less sole depth. So you're going to need to do the same idea of a realignment trim, but now you don't have enough material under P3. So your trim is going to end up on 2 planes. Okay. Your trim. So you've got this existing sole plane and the new one you're creating. So it's going to look like this. You're going to lower that heel potentially, but you're not going to blend the plane all the way forward, because if you did, you would have to take this heel so short if you wanted to bring that all the way forward this way that you would end up thinning the sole too much. Okay. We're still going to back up the toe. We're still going to take the dish out, but what do we do with this negative space here? Because are they going to just rock up onto the front of this toe? Potentially, right? Like this. So you've created this plane here, and this is the old plane of the sole that you don't want to thin. So this toe needs support. And you can do that with a hoof boot with a thick pad, potentially, or you can do it with a composite shoe. So this next example is not the best example to show you for this because it's an acute case that we had to do a tenotomy on to get the realignment. However, this is actually the pony in the first 3 videos, or the first 3 pictures and videos of this presentation. However, I like it because it shows the trim on 2 planes really, really, really well. Okay. Because clearly this pony is up on his toe and he's even like broken off the front of the bone. You can see that scary gas line here where that's the detached laminae with the fluid in there. He's actually crimping his coronary band, so we're losing some circulation here, and he cannot put his heel on the ground. Okay, so we're stuck. There's nothing we can do here to realign this horse. If I would trim his heel more, he would just not load it. If I would back up the toe, he'd be even more on the tip of this bone with the bulging sole. So he needed an emergency intervention. So our vet came out, cut his deep digital flexor tendon so we could do the realignment. That was the goal, is to get him off this bone because he's clearly damaging it incredibly. And he has no time. We have no time to mess around with this. He's out of time. This was the plane. Okay, this is after the tenotomy. This is his trim. Now this is scary. Okay, I'm not saying, after watching this presentation that you're qualified to go do this. But this is the idea of preserving sole under P3 and yet realignment in the trim. Okay, so you can see here how this sole here is not touching the ground. And then this is the bevel on the toe. And then I didn't take the laminar wedge all the way down because this area is very tenuous and it's not stable. So I needed to leave the external hoof capsule in this case as a connector from the sides of his foot together. Okay, so remember, never say never. There's a time and place for everything. This is one of those cases where I'm not going to take this dorsal wall down yet. This horse is too unstable. Okay, so now to look at that, this is the plane of the foot here, and there's air back here around the frog. That's why it's kind of blown out, and the sole is bulging, okay? But we created a new ground plane here, and then this is the old plane of the sole, and then I beveled the toe. So you've got the bulging sole is now oriented in a different direction, and this is where it kind of gets a little bit confusing, and you have to twist your brain around to wrap your head around what's like happening here. But clearly, you would not want to lower this heel and then blend that plane all the way forward because you'd be in the bone, okay? And this horse would be crippled. He's already crippled, but it'd be even worse, okay? So acute versus chronic horses, you may want to have a plan in place for each type, meaning the horse is super painful, the vet needs to be involved, absolutely. You need to go slow, okay? The laminae are tenuous, the feet are going to change quickly, and the horse is going to need to stay quiet, right? Stall rest, paddock rest could be really critical because you don't know how much tearing is going to happen on that laminae until it's too late. So it's just a time to pause and get over the acute part and then start doing some significant interventions, okay? In this case, it's important to raise the heels and shorten the breakover, and we're going to talk about why that is as well. And then again, more of a veterinary concern, where the chronic horses, the interventions we provide for them, the pain's going to resolve quickly. The laminae are inflamed and painful, but they're more stable. They respond to normal interventions, booting, pain management, diet changes, they respond, okay? The feet change slower and less acutely in most cases, like it's a long-term process how they got here. They do tolerate movement better, and they're because they usually have some degree of functional scar of laminae. Their laminae are not as completely tenuous. You can start that derotation, trim, and shoeing earlier in the rehab process for these horses, and so therefore the hoof care provider has a more active role. Keep in mind, though, that you need to watch these horses. Any horse that has any version of acute laminitis, subclinical acute laminitis or chronic subacute laminitis, excuse me. You need to watch them for 6 weeks after the underlying cause is controlled because they can still have laminar failure and additional damage for a period of time, even when you think you've got everything kind of buttoned down, which is why it takes time. And a lot of these horses get better and then get worse, then get better and they get worse. So be vigilant for a long time after you feel like you have the best protocol in place for the chronic horses. Even the acute horses, once they start calming down, you don't want to just say, oh yeah, now they can move around the paddock, because they could have additional damage mechanically, if nothing else. Hoof protection, I like therapeutic boots with a wedge pad, okay? We're going to talk about that at number 6, consider leverage. I like the soft ride boot or the cloud boot. The cloud boots are a little lighter and I like the pad a little better, but both are excellent. And then, you can do, a realignment trim on a chronic horse like this. And then also glue on some composite heart bars with dental impression material. And we like to use hoof casting, particularly the slipner casting, to support the hoof wall and provide relief to the laminae. Casting has been shown in studies to relieve leverage on the laminae, okay? However, never, ever, ever glue on an actively laminitic or an infected foot. Never, okay? You're going to want to manage these horses in boots until they're pretty darn comfortable and you feel like their feet are really stable. And then you can start looking at, different options, okay? The reason why this is important with the wedge in the boot is because considering leverage, when the laminae are damaged and inflamed and pulling apart, we need to keep leverage off the wall because it will pull on those damaged laminae. Okay. So we do that in two ways. One is by managing heel height, and one is by managing toe length. Okay. So the whole question of raise the heels, lower the heels, to me is, again, never say never. There's a time and place for everything. It's more about how painful and acute is the horse. Okay. So if you consider the role of the DDFT in laminitis, right? The DDFT is hugely responsible for locomotion. Okay. When we raise the heel, or when the horse breaks over, the deep digital flexor tendon engages, lifts the heel off the ground and starting breakover, and then brings the leg forward and then limits the flip of the toe when the leg is elongated in the stride. Okay. So the flexor tendon being attached to the coffin bone is hugely critical to bringing the whole capsule along as the horse moves. And what brings the capsule with the bone is the laminae. So if you have a horse that has acute laminitis, we need to think about the leverage in shortening the toe and potentially raising the heel, whether it's in a boot, which is just insurance. Okay. It's insurance. These boots are so forgiving, and the horses, even if you give like a tight trim, wedge the heels back up for a period of time. Let the horse in the cloud boot, this pad, they can decide how much wedge they want, how they load the pad. So it gives you insurance. So it's protective. Okay. If you're using a boot with a wedge pad. And if you're trimming the horse and you don't have a boot with a wedge pad, make sure you have something to wedge the heel up, even if you tape it on or, rig something that will give you that heel height back. Because if you stress that tendon and you pull on that laminae, the horse is going to become immediately much more painful. And it's bad. You could really do harm with good intention. Okay. So 7, kill the bugs. There are many different kinds of abscesses in laminitis. Clearly, this is a foot that was in big trouble with this huge undermining abscess in the sole. You've got serum leaking out of the laminae and then detachment of the coronary band here. So if that job of that white line is to seal the sole to the wall and prevent the infiltration of bacteria and debris, a stretched white line laminar wedge can no longer provide that protection. So these microorganisms, bacteria, fungus, mold, spores, they're opportunistic. They love heat, moisture, and something to eat, some kind of necrotic tissue. So the additional necrotic tissue in the laminitic horse's foot, plus poor circulation, right, creates this perfect environment for microorganisms to invade and get just brewing in these feet. And it creates a lot of pain. The other thing that infection does is it prevents the horn from keratinizing, which is why we get these big voids. And that can really destabilize the foot and cause further damage as well. Okay. So we have two different types of drainage we get from laminitic feet. You've got serum, which is a clear fluid. It has water, protein, carbs. It comes out of leaky or injured blood vessels. The serum is like a blister, right? It cushions and protects the underlying tissue from damage. Unfortunately, in a hoof situation, a serum pocket, because there's a hoof around and the laminae are swollen and inflamed and separating, it creates a lot of pressure and pain. Okay. So we typically call these things abscesses, but there's no infection. So technically they're serum pockets. Okay. It can leak out of the laminae like this foot here on the left. It can be a serum pocket pooling under P3. That's the corium around the bone right there. And this horse had a big serum pocket, which undermined the sole. And then unfortunately that laminae can swell so much and there's so much serum in there that it can actually separate the coronary band. And then with sinking and rotation, they can actually prolapse their coronary band or the soft tissue above the coronary band. And this is a really acute problem, big deal as well, but it's not technically an infection. Of course, you're going to be protective against secondary infection because all of this inflammation and heat and serum being things that come from damaged blood vessels is perfect for microorganisms to get started. And so we still want to be protective against infection, even though it's not technically an actual infection. And then the abscess component is when you have an infection. And so when the bacteria or fungus enters the hoof, the horse's immune system, of course, has to defend the area. So it sends white blood cells to the area. Then the white blood cells attack the bacteria. Of course, some of the nearby tissue also dies, and it creates a hole, which then fills with pus, which is the white blood cells and serum and dead bacteria and things to form an actual abscess. And so these in the laminitic horse can look similar, but the exudate is going to be opaque, have a smell, be gray, tan in color, where the serum is clear. It's going to have maybe a blood tinge to it, like a pink tinge, but it's not going to have the smell, and it's not going to have the opacity. And it's a totally different color. So it's really easy to tell which you have. Okay. There are all sorts of tools to manage the infection, and that's beyond what we can get into in this specific presentation, but we will be providing more information on that in the future. I have lots of information on my social media, YouTube, and Patreon, specifically about how I use all of these tools. And some are provided by the veterinarian, and some are things that the hoof care provider or the owner can do, or the barn caretaker, the horse caretaker can do. So all different kinds of things here. So when we look at our hoof guidelines for laminitis that we just went through, having a team, using radiographs, aiming for realignment when it's appropriate, treating acute versus chronic horses differently, ability to provide some kind of hoof protection, thinking about leverage, right? Thinking about, do I want to lower the heels, back the toe? Is this a fairly stable situation, or is it really acute and I need to protect those laminae? And therefore I might want to actually provide a little bit of an opportunity for the horse to raise its heel, and think about bringing the toe back judiciously because things are just tenuous. And then number 7, of course, kill the bugs, right? Guard against secondary infection. So I put together a little mnemonic, which is a way of learning large amounts of info for long-term retention or remembering it. And so it's a little cumbersome, but it worked for me. So I'm sharing it with you and hope it helps you remember these guidelines for laminitis. It's TRACK is the word, okay? TRRAHCK. So there's an extra R and there's an H, but team, radiographs, realignment, acute versus chronic, hoof protection, consider leverage, and kill the bugs, okay? So hopefully that will help you. If you write it down that way a lot and you practice those 7 things, it will stick in your memory. And then if you ever need to remember it, you just think, oh yeah, track. I'm going to remember these 7 things and make sure I'm addressing all of them with the horse in front of me. Maybe you can think about how track systems help horses with laminitis immeasurably because they have consistent movement, okay? So our key tasks, we're going to work with the veterinarian to identify the underlying cause of the laminitis, right? They have to help us with that. We're going to work as a team member to resolve and eliminate any cause of a current laminitic event. Sometimes we're the expert on these things. Sometimes it's the vet. Sometimes it's the owner. Although for me, if I'm responsible for the horse's hoof care, I want to make sure that we're doing everything possible to set me up for success in helping that horse with its feet. I know my lane. I know it's my responsibility. But if there's things that are going on that are going to make it harder for me to be successful, I'm going to speak up about those things. Okay? You want to take a proactive approach in preventing future laminitic episodes. Speak up, say something, whether it's your horse or a client horse, we are the advocate for them. So laminitis is really a disease of prevention. And so if you see something that looks like laminitis, right? If it looks like a duck and it quacks like a duck, it's a duck. Okay? So if it looks like laminitis, the safest course of action is to treat it as if it's laminitis until proven differently. Okay? We need to be vigilant and self-disciplined. This is the biggest thing, our mental place, how we approach it, and really being advocates because these horses suffer so much, right? So if we give the horse the right formula, if we address the underlying components of the inflammation or systemic stress and toxicity, if we give them an environment, if we manage the feet, if the vet's on board, the owner's on board, the caretakers are on board, the horse will heal. Okay, you can take a foot that is this damaged, this chronic. This was a compensatory limb case I worked on years ago, 2004. And back then we didn't have all the tools we have now. And yet, even with all of this damage, and he was so lame on this leg, we did a tenotomy on his foot. And after the tenotomy, after a period of time, we had realignment, a beautiful, a beautiful amount of sole depth, a gorgeous hoof capsule frog, and this we were able to maintain for him forever. So, they can heal, and they will give us something that looks something like a normal healthy foot if they are supported in the best way. Okay? And then this is what this horse looked like then in 2012. His hoof capsule maintained. He looked great. He was really darn sound. He was not ridden, but he, lived his best life and had great friends and ran all over the place and was very, very maintainable at this place with his foot for many, many years. 2007 is when we did that tenotomy, and then 2012 he was still in this great place. Okay, so we manage all the factors: diagnosis, environment, hoof care, exercise is appropriate, everybody working together, and this awful damaged lamini can absolutely heal. Okay. The job of the white line is to seal the sole to the wall and prevent the infiltration of microbes and debris. It should be 1/8 of an inch thick and waxy yellow in appearance. We are all but there on this foot after a period of time. Okay, this is 6 months. That's it. Okay. In laminitis, improving the health and quality of a damaged white line is a key component of successful rehabilitation and long-term management. So think about what opportunities you have that you can create for the horse in your care or your own horses, so that they can thrive despite having current or a history of laminitis. Okay, I hope this was all helpful. We have more content on laminitis and the related topics coming soon, and I look forward to your comments, questions, and sharing more in the near future. Thanks so much.